Our clinical services are widely regarded as amongst the very best in the country. We've achieved this by carefully and systematically taking the evidence base for clinical practice and combining this with the feedback we receive from patients to ensure that we can offer the very best patient experience. One of the most recent examples of this is our Orthopaedics service. In 2007, we opened a new centre for patients requiring primary hip and knee replacement, known as the Derwent Suite. Previously a private hospital located on the Royal Bournemouth Hospital site, we were able to purchase it, refurbish the facility, and now offer it as a specialist centre. Most importantly, we've been able to offer patients a new pathway when they require knee or hip replacements. Now, patients are trained in advance in terms of their rehabilitation. They're able to walk into the theatre for their surgery and start the rehabilitation within 2 hours of the procedure. Often patients are discharged within 3 days of admission, thus reducing by 50% their previous length of stay.
All of our patients, whether they're having a hip or a knee replacement, will be invited to an education session approximately 2 weeks before their surgery. We can answer any questions they have and go through their expectations. They're invited to come to the ward on the day of their surgery, and we'll very often experience physio the same day, if not the next day.
Well, the staff here are wonderful. They are so efficient, they know their jobs, they answer any call, as soon as you find something slightly wrong with yourself mainly, they answer it immediately.
Well, the staff at the Derwent have been wonderful. They've treated me with great kindness and helpful in every way. Nothing's too much trouble at all. They're real stars, and really the operation, I was dreading it, but you know, they've made everything really run smoothly for me.
The Dorset Heart Centre was formally opened by the Princess Roy in 2005. It's rapidly become one of the busiest heart centres in the country, offering a broad range of treatments for complex heart conditions. The unit provides specialist cardiac services to a population of more than 1 million people. The catchment area includes Dorset, parts of Wiltshire and Hampshire.
We have 4 cardiac cath labs in the cardiac intervention unit. We opened the cath labs in 2005, and we just had 3 at that point. And due to large numbers of patients travelling through the cath labs, we had to open a 4th in April this year. We treat on average about 3,000 angiography patients per year, and this year we will be doing nearly 2,000 angioplasty patients. We take patients from all over Dorset, Hampshire, parts of Wiltshire. We're the fastest growing angioplasty centre in the UK, and having started off only 3 years ago, there's been a huge rise in the amount of patients that are going through these labs who otherwise would have had to travel long distances for treatment previously.
Offering state-of-the-art facilities, local clinicians are treating more patients with blocked vessels than anywhere else in England. The centre also provides specialist expertise for dealing with patients whose cardiac function is impaired by complex electrical problems. We are the only such centre operating out of a district general hospital in England.
Today I've had a blockage in one coronary artery repaired with 5 stents, and the whole procedure's gone extremely well, quite painless, and I feel perfectly all right after it. I've been coming here for about 6 weeks, having various investigations, all of which everybody's been extremely good to me, and I really can't speak highly enough about the whole setup here.
In 2007, almost 55,000 patients had their surgery carried out on a day case basis. Much of that surgery was conducted within the Day Treatment Centre. The Day Treatment Centre was designed around the patient journey and provides a state-of-the-art facility to support the increasingly complex range of day surgical procedures. Our hospital sees between 600 and 700 new stroke patients each year, and a further 600 patients are admitted with a mini-stroke or transient ischemic attack. The stroke service is one of the most comprehensive in the area and has received a Beacon Award for the quality of care. The acute stroke unit is provided at the Royal Bournemouth Hospital and the Rehabilitation Service at Christchurch Hospital. We rely heavily on a multidisciplinary team approach for delivering care at both sites. A midwife-led unit is provided at the Royal Bournemouth Hospital. It supports women who wish to have a natural birth without medical intervention. It also supports mothers who wish to give birth at home. In 2007, up to 14% of the babies cared for in the unit were delivered at home. Our housekeeping team play a key role in ensuring the cleanliness of our hospitals. They work as an integral part of ward teams, helping eradicate the possible spread of infection. As part of the many steps we are taking to ensure a clean clinical environment, a new high-tech microfiber mopping system has been introduced. Other measures include introducing screening patients for MRSA, reducing unnecessary antibiotic prescribing, offering single rooms with ensuite facilities, and introducing a new dress code, ensuring that our doctors are bare below the elbow and that no ties are worn during patient contact. These measures will ensure a zero-tolerance approach is taken towards the spread of infection.